The Specialist, written by Dr. Lokendra Singh. He was a middle aged man. Life was smooth. One day, he felt lower backache. Later, pain started shooting down his left lower limb. He consulted a general physician, that is GP. GP decided to refer him to a special surgeon. X-rays and MRI scan of back were done. Tests revealed a large disc prolapse in lower lumbar region. Conservative treatment can be dangerous. Better needs surgery at the earliest, was his advice. Patient got admitted. On evening rounds, the specialist spinal surgeon came accompanied with a large number of young resident doctors. He elicited various clinical signs in detail, explained correlation between neurological findings and findings in MRI scan to young doctors, mainly beautiful young ladies. They were highly impressed with Sir's knowledge. Appreciation was largely written on their faces. This tonic further improved the young specialist's performance. Now he had twinkles in eyes, baritone of voice deepened, and movements became more graceful. The performance concluded with a decision to prepare patient for surgery. Hence, relevant investigations were ordered. A reference was sent to anesthetist for pre-anesthesia checkup, PAC. When she went through the X-ray chest, she found a shallow of the size of a lemon in the upper zone of left lung. It could be tuberculosis or cancer or maybe something else, she thought. She sent a referral for an internist, an MD in general medicine. An impressive young specialist, he gave a small discourse on the coil and cannonball lesions on X-ray chest. Then took out his latest version of touchscreen cell phone and very gently, like a cupid touch, with his index finger dialed number of a specialist in radiology. Few high-sounding complex medical words were exchanged between the two. Then, in one go, he switched off and flipped the cell back in its case, hanging from his belt, just like Rajinikanth slipping the gun in its holster after a flawless shootout. One beautiful doctor widened her already big eyes further and dropped her jaw. Specialist saw this through corner of his eyes. He was happy. He had his kill for the day. Get a CT scan of chest done and please inform me on my cell once report is available, he said to the doctor in a sweet voice. CT scan was done, but it was absolutely normal. Now what? Internist was puzzled. His charm was getting diluted. He sent a referral for a pulmonologist, specialist of lung disease. He ordered an MRI scan of chest. Patient was by now really scared. He hardly bothered about backache and pain in leg for which he had come originally. Extended stay, examinations by specialists after specialists, mini conferences at his bedside, and discussions in muffled voices made him a worried man. On few occasions, words like cancer and malignancy had fallen in his ears. Since then, he had almost gone in depression. Well, the MRI scan was done and it also turned out to be normal. Pulmonologist came again. He was like CMP, that is, confused mass of protoplasm. Spinal surgeon, internist, and pulmonologist had a serious discussion at patient's bedside. The brigade of young lady doctors had already lost interest in the case and ability of all these sirs. Hence, they were now accompanied only by an old nurse. Finally, pulmonologist decided to use his highest weapon, the bronchoscope, a medical grade telescope which is passed in the windpipe and down to visualize lung structure from inside. Case was scheduled for next day. In the evening, director of the institute, an old fatherly figure, was on rounds asking patients for their feedbacks. When he reached this particular patient and heard his story, director felt sorry for him. He caressed his back with his hand in a sympathetic gesture. Suddenly, he stopped and asked the patient to remove his shirt and turn away from him. And lo, there was a lipoma, a lump of fat, hanging from the skin on the upper part of left side of chest. Obviously, it was casting the mysterious shadow. The young brigade giggled madly. Actually, the clinicians had focused only lower back, legs, and front of chest, while radiologists only on structure within rib cage. He was examined as a body part and not as a human being. Obviously, the lesion was missed. The unimpressive old man spoke impressive words. Person with conical vision and the one who knows more and more about less and less is called the specialist. Thank you for listening.